Ready? Yes?
Yes, ma'am.
Yes.
Yes.
I've started the timer and here is your question. Random anatomy.
Yes, ma'am.
Yes. So if you have read and understood, kindly identify, looking at picture 1 on the left hand side, picture A, if you can identify structures A, B, C, and D. And first of all, tell me these are from which region?
Ma'am, I think it is, ma'am, 7th cervical vertebra, ma'am.
Very good. Can you identify A, B, C, and D?
Ma'am, A is here the superior articular facet of the 7th cervical vertebra.
Yes, keep on telling me.
Yes, ma'am. Yes, and yeah.
B?
And B is here, ma'am, the lamina of the vertebra, and C is intervertebral foramen. Sorry, ma'am, C is vertebral canal.
Yes.
And D is the pedicle of the vertebra.
Okay. Moving to picture B, A and B, if you can tell me.
Yes, ma'am. A is the transverse process, and B is
It's
here
a
the
face.
inferior article.
Yes, face it attaches something.
Yes,
else.
ma'am.
And this B?
And B is the inferior articular facet.
Very good. And picture C, what is this? What
Ma'am,
transmits from this?
I think it's above the C7. Actually, there is a foramina in the transverse process, and it's a here through here that passes the vertebral artery. Actually, ma'am.
Okay. Anything else?
Yes, ma'am. There goes vertebral artery, and sometimes there is a vertebral vein, and
Venous plexuses are always there.
and
okay.
Also, ma'am, yes, ma'am. And
how
also,
many
ma'am,
cervical vertebrae are there?
There are actually 7 cervical vertebrae, ma'am.
Okay. Can you tell me the difference between first and second? What are they called, and how would you differentiate between them? Why are they atypical?
Yes, ma'am. The first cervical vertebra, actually, it is called atlas, and
Yes.
its peculiarity has, ma'am, it has no body, actually, ma'am. It has
Okay.
bifid spinous process.
Yes.
And and the 7th cervical vertebra, it is actually it has actually, ma'am, the longest spinous process than other cervical vertebra. And
Yes.
also, ma'am, the on the first cervical vertebra, there lies the posterior on the posterior superior surface of the posterior arch, there lies a transverse pathway for the passage of vertebral artery. And
Okay.
in the 7th cervical vertebra, the spinous process is more longer, and in the transverse process there will be no foramina there. And
okay, can you please tell me what are the ligaments which are attached to odontoid process, please?
And ma'am, there are 3 ligaments actually attached.
Yes.
That is apical ligament of Dens,
Yes.
transverse atlantal ligament, and another
Yes.
one is, ma'am, alal ligament.
Okay, what type of joint is atlantoaxial joint?
Atlantoaxial, ma'am, it's actually it's a synovial pivot type of joint.
Okay, what are the ligaments which are attached between C1 and C2, please?
And that will be, ma'am, anterior atlantoaxial joint, posterior atlantoaxial joint, and transverse ligament.
Okay, first spinous process, where would you feel it?
Ma'am, I will first feel it at the 7th
Yes.
I'll first feel the 7th cervical vertebra. I'll feel, because it is the most longer, and it's not bifid, because and the upper cervical vertebra, there lies like more muscles are attached over there, and that's why I cannot feel them, ma'am.
Okay, can you please tell me why would you not be able to feel superior spinous processes or upper
Yes, ma'am.
spinous
Superior,
processes?
yes. Upper spinous process is actually, ma'am, shorter. They are
Yes,
bifid, and
yes.
their muscular attachment is more than the seventh one. That's why.
Attached to the knuckle ligament.
Ligament,
Yes.
knuckle ligament, yes, ma'am.
So, out in the cervical region, how many cervical vertebrae are categorized or have the features of being atypical?
Ma'am, actually, it's C1, C2, and C7.
Yes. Can you quickly tell me what are the differences in them, or what
Yes,
is
ma'am. In
extra in
C1,
them?
yes, ma'am. C1, there is no vertebral body, and there lies group for the vertebral artery on the posterior arch. There is and bifid spinous process. In C2, ma'am, there actually the body projects upwards to forms the odontoid process. There is also bifid spinous process, and there is foramina in the transverse process. And in the C7, the spinous process is the most longer, and it can be felt superficially. And there is no transverse process, foramina on the transverse process in C7, ma'am. And the body is more like heart-shaped, like thoracic vertebra.
Yes, very good. Okay, if you have to differentiate between cervical vertebrae and lumbar vertebrae, so what are the characteristics of lumbar vertebrae?
Actually, ma'am, the lumbar vertebra actually have the body. The body is actually kidney-shaped. It is
Yes,
broader, stronger, and more bulky than any other
yes,
region. The
yes,
vertebral foramina is triangular shaped, and
very good.
it accumulates less space than the cervical one, but more space than the thoracic one. And the spinous process is the square shaped, hatchet shaped. It is it's
Short
more
and
thicker,
sturdy, yes.
shorter, sturdy. Yes, ma'am. And
What about the transverse processes?
yes, in the transverse process, ma'am, there in the base of the transverse process on the posterior aspect, there lies the accessory process, and in the in the posterior aspect of the superior articular facet, there lies the mammillary process, ma'am, for the
Yes,
mammillary process. Yes, and the superior articular facets are located anteromedially.
yes,
Yes, ma'am. Located anteromedially, and inferior articular facet located directed actually posterolaterally, ma'am.
inferior one, yes, posterior, anterolaterally. Okay, yes.
Yes, ma'am.
What about the positions of lumbar spine? They gives it gives when it gives lumbar lordosis. What do you mean by that? What do you understand by that?
Actually, ma'am, it's the physiological curvature of our body, and
Yes,
that maintains the normal curvature of the vertebral column.
yes,
And actually, it occurs due to in the lumbar region, and as also in the sometimes in the also in the cervical region, and the intervertebral disc and the vertebral bodies actually change their shapes to maintain the lordosis, and and the lordosis is convexity in the front and concavity behind them. It maintains in
okay.
that way, ma'am.
What are the movements which are present at lumbar vertebrae?
Actually, the movement is, ma'am, flexion, extension, lateral flexion, and the axial
Yes.
rotation.
Okay. At what level of spinal cord ends in adult and in the newborn?
Ma'am, in case of newborn, it ends at the level of L3, and in case of adult, it ends at the level of in between L1 and L2, ma'am.
Okay. Can you tell me what are the contents of the spinal canal below L2?
Okay, ma'am. Below L2, there will be, ma'am, chorda equina, phylum terminally, conus medullaris, and there
Yes.
will be
Good.
root of the spinal nerves, and also the CSF, ma'am.
Can you tell me the location of paravertebral venous plexuses?
Yes, ma'am. There are actually 4 paravertebral venous plexus, that is anterior external, anterior internal, posterior external, posterior internal. The anterior external actually a smaller system, and it's around the vertebral bodies, located anteriorly, and the posterior external one is the extensive venous system. It is around the vertebral processes. It locates around the vertebral processes, and the anterior internal one, it lies in the vertebral column, in the vertebral foramen actually, and inside in the front of the dura mater. And posterior internal one, it also lies in the vertebral canal and posterior to the dura mater, ma'am.
Very good. Okay. Can you tell me is there what transmits intervertebral foramen?
Yes, ma'am. The intervertebral foramen actually transmits the spinal nerve roots, dorsal root ganglia,
Yes.
and also ma'am, recurrent meningeal nerves. These three nerve components, and they are
Spinal
also
artery.
spinal artery from the segmental artery,
Yes.
and the communicating veins between external and internal vertebral venous plexus, and
Yes.
also there lies, ma'am, transforaminal ligaments. These 6 components.
Recurrent meningeal nerves.
Yes, ma'am. Recurrent meningeal I have mentioned.
Okay, and how would you do
Arena's
lumbar
nerve.
puncture?
Actually, ma'am, the lumbar puncture actually performed at the level like between L3 and L4 vertebra, and that is situated at the highest point of the iliac crest, ma'am. So, ma'am,
Okay.
so I'll first identify the highest point of the iliac crest. Then on the behind, I'll identify the space between lumbar 3 and 4, or lumbar 4 and 5, and then through that space, I will insert my needle, and whenever I cross the ligamentum flavum,
Yes.
ligamentum flavum actually, ma'am, then I will feel there will be loss of resistance. I will feel like in that way. So there will be coming out of the CSF, ma'am, after
Okay,
passing
very
through some
good, very
layers.
good. Can you name few tumors which metastasize to the spine?
Yes, ma'am. It may be, ma'am, prostatic carcinoma, lung carcinoma 31% cases, and prostatic carcinoma actually 8% cases, and breast carcinoma, that is like 22 to 30% cases, and there may be some melanoma, skin melanoma, and also there may be some renal carcinoma.
Yes, or multiple myeloma, others.
Yes, ma'am, and
Very
others.
good.
There are also others. Yeah.
Okay, now coming back to neck region again, can you tell me
Yes,
what
ma'am.
are the structures which are found at the level of C6? Because C6 is a very important landmark.
Yes, ma'am. Actually, at the level of the C6, there lies, ma'am, from the trachea, there will be, sorry, from the larynx, there will be beginning of the trachea. From the
Yes.
pharynx, there will be beginning of the esophagus.
Very good.
And the,
Entry of
yes, ma'am, entry of the
vertebral
inferior,
artery
yeah,
to the
also,
foramen.
ma'am, entry of vertebral artery in the transverse vertebral foramen, transverse foramen of the vertebra in the transverse process of the
Yes.
C6, and
And
there will be entry of the superior inferior thyroid veins into the thyroid gland.
middle thyroid vein.
Middle, oh sorry, no,
Inferior
middle thyroid.
thyroid artery.
Okay, ma'am, inferior thyroid artery and middle thyroid vein. Yes.
Yes. And there is one tendon.
There is one tendon, ma'am.
Immediate tendon of omohyoid. It crosses the carotid sheath at this level.
Okay.
All right, it's
Yes,
not that
I
important.
forgot.
All right.
Sorry, ma'am.
Last, and then bell has gone, but still for the sake
No,
of
no, it's
covering
okay.
the
It's
whole.
okay.
If you can tell me the surface marking of hyoid bone.
It's located at the level of the C2, ma'am.
C3.
C2 and 3.
C3.
I guess,
Okay.
ma'am.
All right.
Yeah.
Surface marking of cricoid cartilage.
It's located at the level of C6, ma'am.
Very good. Okay. Surface marking of posterior triangle.
Okay, surface marking of the posterior triangle, it is bounded, ma'am, actually anteriorly by the posterior border of the sternocleidomastoid, and posteriorly by the anterior border of the trapezius, and inferiorly, inferiorly by the middle one-third of the clavicle, and it is divided into 2 triangles by the inferior belly of the omohyoid.
Very good. And if you can tell me the surface marking of roots of brachial plexus.
Okay, ma'am. The roots of the brachial plexus actually emerges from the intervertebral foramen between the scalenus anterior and posterior. Actually, it is situated near the basal region of the posterior triangle of the neck.
Very good. I don't think you have left anything. Excellent. Superb. Thank you.
Yes. Scalenus anterior, medius, brother. Between scalenus anterior and medius.
Medius, yes. Yes, it passes on your vein. Very good. Very good. Excellent. Yes.
Thank you, ma'am.
Anyone else want to add anything to what Dr. Abhishek has told us? No? He has covered the whole head region and lumbar. thorax is left.